Hi, I'm Sharma Karan with Thai Healing Massage Academy. Welcome to another edition of Thai Massage Tips and Tricks. Today I want to talk about how we can work therapeutically in Thai massage. Now, if you want to work therapeutically, this does not mean that you have to know 250 different techniques. But what it does mean is that the way how you approach it is different from doing a whole body massage. See, if you just work from the feet all the way up to the head in the prone and supine position, you just go through the whole body, then you just don't have enough time to focus on an area where the problem really is. So let's say, as an example, someone tells you, oh, I really have back pain, can you work on my back? And you want to do a good therapeutic job, so how do you go about that? In that case, well, it depends how long the session is. Especially if you have a shorter session, 1 or 1.5 hours, there's just no way you can do a whole body session and spend enough time on the back. So in that case, you would just not do a whole body session, but you would focus on one particular area and spend a lot of time, or most, or maybe even all of your time on that area. So there are some elements when you work therapeutically. One element is that you just stay long enough on one area. See, if you just work a little bit here, a little bit here, a little bit here, a little bit there, you cannot work out the kinks in one particular spot. The next element is that you modify until it works. So what do I mean with that? Well, not all techniques work on everyone. You will find that out the more Thai massage you do. You cannot just use every technique and use it on everyone. It just doesn't work. Maybe it's the size and weight difference, or the person's pain sensitivity, or just a preference, or whatever. You cannot do every technique on everyone. So you have to find out what works. And sometimes you just have to do one type of technique in 3-4 different ways to find out, well, what feels best for the client, what gets you the best results. So that's the second element. The third element is that you need to use your energy and your intention. In other words, you cannot just work on someone. You have to connect with someone energetically. You have to project a feeling of healing, an intention of healing. Let me give you an example. If you walk into a room and the room is full of angry people, aggressive people, you feel that, right? You just notice there's something wrong here. But if you walk into a room full of peaceful, loving people who just have this wonderful energy, you feel immediately that you are in the right place. This feels good. You can tell the difference even if nobody says one word. So what's the difference? Well, there is an energy that you picked up on. If you have this intention to work with your energy, to project healing energy, then that will be felt by her, just like you felt the positive energy when you walked into the room with all the loving people. However, if you work on someone and you don't care, you know, you do something but your mind is somewhere over there, you're thinking about dinner, you're thinking about the last fight you had with your wife, or you're thinking about the football game that you want to watch on TV, and you don't project this energy, then what you do will have less effect because your energy is not into it. That's a different thing to work with and without energy. So with energy, I mean feeling, intuition, intention, that's what I mean. The next element is communication. If you work on someone and they have pain somewhere, then you should find out, how does this feel? You don't just do something. See, that's the difference between working on someone and working with someone. You don't just this technique, that technique, that technique, and you just do your thing. But you talk to your client, you say, how does it feel? How is it on a scale from 1 to 10? Where does it hurt? Is it getting better? it was an 8 and now the pain went down to a 5. Very good, we're making progress. So you're using communication to instill confidence in the client. The last element is that you need to work slowly to feel what is happening under your hands. If you just rush things and you just do your technique and you just quickly work, you'll never feel anything. So you need to work slowly. So now we have those 5 elements. And between those elements, you do therapy work. Number 1 is you stay long enough in an area. Number 2 is you modify your techniques until they work. Number 3 is you work with energy intention. Number 4 is you communicate with your client. And number 5 is you work slowly enough that you can actually feel what's happening. So now I will show you some practical demonstration what not to do. If someone tells you, I have back pain here, you don't attack them with a massive stretch. So to give you kind of ridiculous example, let's say she just told me, oh, my back hurts. And I say, all right, let's do some stretch here to fix you. And you grab them and hold me. And you pull them into the cobra. All right, I'm fixing you here. I'm doing a massive Thai massage stretch. Now, that's the last thing you would ever want to do. You start out by doing something to feel where is the problem. And now you want to use your hands as a listening instrument, not as an instrument just to do something with. So in other words, you're looking for something. Does it feel tight? Does it feel ropey? Does it feel knotty? Does it feel inflamed? Does it feel swollen? Does it feel hot? Does it feel cold? How does it feel? Where are the knots? So you do that by doing gentle work, circling, wiggling, little rocking, just sensing, and you focus on what is happening under your fingers. So that is how you find the problems. And you work slowly enough that you have time to feel. And while you do that, you talk to your client and you say, okay, so this here feels knotty. Do you feel something there? And they might say, yeah, that's where it is. So see, clients like if they're included because they feel they have a say. If someone feels, well, I can talk from my personal experience, if I tell a therapist I have a problem somewhere, can you work on it? And they never say one word. I just don't feel included. I feel like they're just working on me, but they're not working with me. So it feels better if you include the client and they will have confidence in you because they know they're included in the process. You're working with them, not just on them. So working on someone is never therapeutic. Working with someone is therapeutic. All right, so you do your checking, your sensing, your feeling. You try to allow your intuition to come through. So sometimes when you work on someone and you shut off your thinking, in other words, you're not thinking, oh, what is this muscle I'm working on? But you just try to not think, just focus on your work and allow impressions to come into your mind. And sometimes you'll just feel something, you don't even know where it came from. It happened to me many times. So allow intuition to manifest in your mind. And that's another thing you can just practice. If you've never done that, well, you probably won't feel anything or hear or notice, see anything. But if you do it often enough, sometimes you just get an impression and it's just the right thing. This is actually what you needed to know. Just trying to find out what's the problem, you try a few different techniques. So for example, you work with your fingertips, then maybe you work with the heel of your hand a little bit stronger, or you work with your forearms. And you might work even with your knee. So, and when you do all those things, some might work very well for one client, but some might not. And again, you find it out simply by communicating. You can tell your client, you know, I'm going to try something. Tell me if that feels better. Tell me if that helps. Or you can say, well, let me use a couple of techniques here and tell me which one feels best for you. and the client will tell you. So in this way, you don't have to just rely on doing whatever you know, but you get feedback. That is part of therapy, part of working with someone. You can get stronger, of course. You can use strong stretches, but not in the beginning. First, you have to figure out what's going on and feel everything, communicate with the client, and just try to use your energy, your intuition as much as you can. And you try to figure out what works, what the client prefers. And when you've done all that, and you might work on an area 10, 20, 30 minutes like that, then you can add also some stretches. So let's say, all right, you figured out this is nice and warmed up, and now with everything being warmed up, now is the time to introduce techniques that are stronger, like stretches. So for example, you might do a spinal twist. If the client is ready for it. So that works mostly on the upper body, or here is something that works more on the lower body, on the lower back, I mean. So that works on the quadriceps, the hip flexors, and the lower back. So in other words, you go from gentle to stronger. You never start with stronger. So this is how you work therapeutically on someone. Basically, it just means you stay on an area and you keep doing things there until you get a result. And you find it out by asking your client. Let's say in the beginning you do something and you say, oh, how much is that pressure on a scale from 1 to 10? And they say it's an 8. 20 minutes or 30 minutes later, when you've done a lot of work, you ask them again, how is this pressure on a scale from 1 to 10? And now they might say it's a 3. And then you say, that's great. In the beginning it was an 8, now it's a 3, so we're making real good progress. And the client will say, oh yeah, that's good. Because now that's your proof that you accomplished something. So these are all elements of working therapeutically. I just wanted to give you this treatment protocol for how to approach Thai massage in a more therapeutic way instead of doing a whole body session.